All right, in this video, just wanted to talk a little bit about hamstring strain recovery. So I just wanted to chat a little bit about how we would kind of like treat this in the clinic and the kind of phases that you would go through that. We'll be going into the phases of recovery and a few other things in more detail in other videos, but just wanted to give you a general kind of overview. So first of all, what is a hamstring strain? So a strain is a muscle injury where there's tearing of the fibers, and they grade it into 3 grades of severity. First grade being just a minor tearing of the muscles. This can take anywhere from under a week to 3 weeks to fully recover and get back into normal activity. Grade 2 is a little bit more of a moderate tearing. Up to around 50% of the muscle fibers have been torn in the muscle. So this will usually result in a little bit more pain and sort of like disability and a longer recovery time, like 2 to 8 weeks, depending on the severity and the location of the tear. Grade 3 is the most severe, and it can be like a full rupture or almost total rupture of the muscle. Often these will require surgery, so you want to make sure you're checking in if you're suspecting that. That can be 12 weeks plus recovery. So with the recovery process, when you come in and see us with Chinese medicine, we're always looking at how we can support the body as a whole. So it's really important that we support your recovery processes in general, as well as the targeted sort of things for the hamstring. So the general stuff is stress loads, your quality of sleep, and quality of digestion. So these kind of processes are the processes your body sort of repairs, rebuilds, recovers. And we just want to make sure that we're doing things to help support that if any of those are out of whack. Now, specifically for the hamstring, the phases of recovery, you're going to go through a few sort of key phases, and things will kind of like change in terms of how we approach the treatment and the kind of exercises that you'll be doing. So first phase is kind of like damage control. You've just injured it, you want to look after it. So you follow the PRICE guidelines, which is protect, rest, ice, compression, and elevation. So yeah, essentially just protecting it and stopping from re-injuring it. We're going to be, in the clinic, we'll be using distal acupuncture, so points away from the injured area, to help reduce, with the idea of helping reduce pain, promote circulation, promote a little bit better movement, and just to sort of ease you through that process. We've also got Chinese herbs that can be useful for swelling, inflammation, and things like that. Phase 2, you're out of the sort of main acute pain phase, still have pain, still have restriction, but you're starting to gently incorporate movement and re-strengthening and gradually building up the intensity there. So there's certain exercises that you'll be doing at this time. With the acupuncture, again, we're looking to reduce pain, promote circulation. We'll probably have you sort of like moving a little bit during the treatment with distal points, so points distant to the affected area, which allows you to move it and start rebuilding that neuromuscular control, which is affected during injury. Again, we've got herbs to support that process as well, and we kind of like tailor those according to your needs. Phase 3, you're starting to really ramp up strength and getting to like a little bit more speed and higher intensity exercise, using pain as your guide. Like if you did some rehab exercise and you pulled up the next day feeling really sore, that was too much, so you're backing that off. And that's the same for all these phases, but particularly as you're getting close to that finish line of getting back into normal activity, you don't want to be sort of pushing it too fast and getting back and then just hurting yourself and winding up in an even longer recovery time. So yeah, incorporating a little bit more speed into your exercises, a little bit more strength. Acupuncture, we may start doing some more kind of like treatments around the area to address any like inhibitions in the muscle or tight bands in the muscles around the injured area, and sort of helping promote like good scar tissue healing. Again, the herbs can also help just overall making sure if you've got any like troubles with sleep or digestion, that we're addressing that as well. And then once you've returned to sport, it's really important that you keep up with your sort of rehab exercises, looking for symmetrical strength and mobility side to side. because 1/3 of hamstring strains will re-injure within 1 year of returning to sport. So really important that you keep up and keep mindful of that, and sort of build that back up. And obviously coming in for acupuncture once every few weeks or so can be useful to just check in and make sure that everything's still sort of like balanced, and you're doing the best. We're doing the best we can to prevent future injury there. Anyway, that's a little bit of a brief rundown of the phases. In other videos, I'm going to go into a little bit more detail with some like exercises, also show you some acupressure stuff and some diet stuff that might be useful for the recovery process. But yeah, if you found this video useful, please give us a like, share and subscribe, and stay tuned for our other next videos. Thanks.